Certainly, a lot has been said about gender transition, but most of the time, I find it's people arguing over whether or not it should be practiced. And I think we never really hear from the people who went through it in the first place, those individuals who regretted it and later detransitioned. Now, detransitioners, most of them young women, are often ignored and dismissed by the very people and institutions that set out to help them in the first place. It's not clear whether or not there are any off-ramps for these individuals, or if much thought has been given to the topic by those who claim transitioning is life-saving. But that's starting to change. A growing movement of clinicians, of lawyers, and of former patients are beginning to push back. They're seeking accountability and justice for those harmed by a system that treated medical safeguarding for political slogan. Today on the show, I'm joined by Michelle Mackness, a former therapist turned advocate, and Lynn Chadwick, founder of Themis Resource Fund. Together, they're fighting to give detransitioners a voice in the clinic and in the courts. I'm Melanie Bennett. This is Disrupted. We are going to talk about detransition today. We don't talk enough about gender ideology these days, but we certainly don't talk about detransitioners enough at all. And so I have with me Michelle Mackness and Lynn Chadwick. Now, I'll start with you, Lynn. You are the founder of Themis Resource Fund, and I am dying for you to explain to me what that is.
Yeah, so Themis Resource Fund was founded to assist detransitioners to obtain and fund litigation so that they can be heard in court and receive justice.
But that's in America.
Yes.
Is there Themis in Canada as well?
There is not, and we certainly hope that we will be able to assist people in Canada as well at some point. I think this is relevant all over the world, however, because court cases that happen in America will affect things that happen in other countries. And so we have to start somewhere, and we have to do something that is possible.
And okay, we'll get to those court cases in a minute, but I want to move to Michelle. I didn't even thank both of you for being here, but thank you for being here. Maybe you could tell us a little bit about therapy when it comes to gender affirming care and trans in Canada, because you're a therapist and you deal with some of this here in Canada, I might add.
Hi, Melanie. Yeah, thanks. Gender care in Canada is exclusively basically gender affirming care. So that means a declaration of a trans identity is accepted at face value and no further investigation is warranted. There is direction to perhaps look into comorbidities, but no actual valid psychometric tools are required, and there is no what is termed gatekeeping, but what we could also term as medical safeguarding. There's no medical safeguarding in place.
Do we know what the numbers are for detransitioners in Canada? Is that something that's tracked? Because we've seen a really big increase in especially young people transitioning at younger and younger ages. And obviously these kids are getting older now. So we don't have any idea of what that might look like.
Yeah, I'd like to jump in on that one. So we don't have numbers. But what we do know is that many thousands of young people have quickly transitioned medically without a lot of therapy, without a lot of even time in between their announcing that they're trans and going on hormones. Sometimes it's as quick as 45 minutes in like a Planned Parenthood or a doctor. Sometimes it's on phone or over Zoom. There are even apps you can get on your phone and you can get hormones and surgery letters on an app. These people have never even seen you. And so since we're transitioning young people by the thousands, we have every reason to believe that there will be thousands of people getting back off of this ride at the end of it. And there are currently very few off-ramps. And that
I think you're talking about
we're going to need help for these people.
I just want to add to that. I seem to remember a talk given at the GenSpec Denver conference that they predict the numbers to be somewhere based on data from the military, apparently. They expect the numbers to be around 30%. Currently, if you are in the gender wars, for instance, gender affirming care proponents suggest that it's 1%. But again, we don't track it. Many detransitioners do not return to the clinics where they were transitioned. I think the number is somewhere around 70% say they did not inform their former providers that they were detransitioning. And if you just want to take a look at what some of the agencies in Canada who promote transition are doing for detransitioners, it's pretty close to nothing. So if you go to a GAL, Canada, for instance, and look up the words desistance, detransition, or regret, you get 0 for desistance, 0 for detrans, and 5 instances of regret. One is as a straw man argument around people say most people regret transition. I don't know if that's true. That's not an argument I'm familiar with. I'm sure someone's made it. And the other 4 have nothing to do. One is like from a letter from 1994 from a member of parliament around sexual orientation. So that must have been when we were fighting for marriage equality in Canada. None of them, though, have to do with transition regret in a meaningful way.
It's my understanding that position in Canada would be that supporting detransition might equate to conversion therapy. So I guess it wouldn't be surprising that organizations like EGAL, or possibly even the therapeutic industry, might be cautious providing supportive services for young people who detransition. I would be horrifying to know if you have a young person coming to a therapist saying, I'd like to detransition, what they might do in that instance. But maybe what we could do is move to the litigation. So law, going to the courts and having courts decide can be useful. So I'd be curious to know, Lynn, what kind of cases are you supporting?
Well, so far Themis has financially backed 5 cases in the U.S. They're all different. They're all people who regret their transition and were harmed by affirmative care, such as hormones and surgeries. And when I say harmed, I mean deeply harmed. And another reason that people are suing, they're suing not only for medical malpractice, but also for fraud and also for discrimination. Because one thing that people don't really stop and think about is that a lot of these young people are gay or lesbian, and they're being led to believe that if they transition, they'll be straight and they can't be gay anymore. And so that is a type of discrimination against homosexual people. So that is actionable in court as well. But people are suing for those basically those 3 things: fraud, medical malpractice, and discrimination.
So when you speak of fraud, are those cases, is that in reference to informed consent? Essentially being sold a faulty bill of goods?
Right, because they're being told that if they have these procedures, that all of their mental health issues will go away, and that's not true. Also, we have found instances of fraud. For example, Prisha Mosley is one of the detransitioners that is currently suing. And at a recent Federal Trade Commission hearing, we were shown notes from her therapist. And on the same day, her therapist wrote a note outlining all of Prisha's significant mental health comorbidities, such as major depression, borderline personality disorder, and there were several more. On the same day, the same therapist wrote a surgery approval letter stating that Prisha had no significant comorbidities. So one of those things is a lie.
Yeah, well, what happens to these individuals when their comorbidities aren't being addressed? Because some of those sound pretty severe that actually need some kind of guidance to pull. Like, you're not just going to suddenly stop being borderline. If you have borderline personality disorder, for example, you're not just going to suddenly stop if you take a different course of action.
Right, but these people believe that your only real problem is that you're trans, and once we solve that, all these comorbidities will magically go away because they're all a result of minority stress and discrimination that you've experienced because you're trans and no one is supporting you.
Would that be like saying
they don't get any help?
Yeah, so would that be like saying they're treating they would believe that they're treating the source of the problem rather than the symptoms of the problem, and if you treat the source of the problem, which is the state of being a transgender individual, then all of the other problems would just go. They would go.
Right. So it's so easy to hand somebody a prescription and a surgery letter, and now you've solved their problems, right? Now you don't have to do any actual therapy.
Yeah. Yeah. So Michelle, in Canada, do we have cases of detransitioners going to court?
We do. I'm aware of 2 cases that are currently ongoing. One is the first one that I'm aware of, and I believe it was the first one in Canada, is Michelle Mackness' case in Ontario, which she launched in 2023. She is a detransitioned woman with an extensive history of mental health conditions, and she had minimal assessments done or clinical interviews. I'm not privy to all the details. And then was put on hormones. A year later, she had a double mastectomy, and then 9 years later, she had a full hysterectomy. And surprisingly, her mental health conditions did not improve with these risky and ultimately painful surgeries for her. Since she's detransitioned and has gone through proper, ethical, comprehensive assessments with a psychologist trained to do clinical assessments and differential diagnoses, she's been diagnosed with ADHD, autism spectrum disorder, traits of post-traumatic stress disorder, borderline personality disorder, and clinical depression. None of those were being addressed through surgeries and hormones. The second case in Canada, also Michelle has a fundraising site that we could maybe put into the show notes later. The second case in Canada was launched in 2025 by Lois Cardinal. Lois is a trans woman living in Alberta. She's, how does she describe herself? A First Nation post-op sterilized woman. I think I'm getting the order wrong, but she is not detransitioning. She's a regretter, though, and her lawsuit is around again just being rushed into treatment. The clinical assessment process was rushed or ignored. In order to secure funding. There were some changes going on with funding at the time, I guess. This was quite a while ago. So there were more safeguards in place at the time, but it looks like they were overlooked. So even the ones that did exist were not heeded. And she had vaginoplasty in, I think, 2009. She's been in
which, just to be clear, just to be clear for the audience, the vaginoplasty would be the reversal. So like the outie becomes an innie.
Yes, yeah. Incredibly high rates of complications and very risky surgery. Lois for a time was looking to do MAID because her life had become so unbearable, and she's, I believe she was declined. So she's launched this lawsuit. And, one of the things that I find really telling about this entire movement is one of the things that Lois says was not taken into consideration, in addition to her longstanding mental health issues, is the cultural piece. And despite the fact that Canada has now moved two-spirit to the beginning of the alphabet soup situation, they did not take into consideration the cultural context from which she came and how her surgery would affect the way people in her community view her and how that would affect her capacity to pass down traditions within, I believe she's Cree, within her Cree community, her First Nation.
So correct me if I'm... Correct me if I'm wrong, but Michelle, you're a therapist and you are engaged in advocacy, and I imagine some of that would be to try to raise the issue that of how we're treating gender and gender transition and gender care in Canada is perhaps not the right approach. How are you finding advocating for that? I mean, are you able to make headway? Are you able to get a message across?
Well, I'd like to clarify that I'm a former therapist, and former being the key word. So, former therapist, and I was never able to diagnose. That was outside. I'm not a registered psychologist. I'm not a psychiatrist. It's hard to get the messaging across because there's the whole Brandolini's principle, which you may or may not be aware of. It's the sort of bullshit asymmetry principle, which is it's a lot easier to spew lies and bullshit than it is to refute it. And I think in Canada we're really fighting that. There's been almost exclusively, as you know, a mainstream media blackout until around 2020, 2021. Prior to that, there was like zero coverage, and the only accurate coverage in mainstream media is probably coming from National Post. I haven't really seen anything out of the CBC, CTV, or Global that's been remotely objective or accurate. And as a therapist, well, I left my profession, so I no longer offer clinical services. I don't work with people who are struggling with psychiatric or psychological instability. I work with what is called like the worried well. So individuals who are functioning and maybe want to engage in self-examination, that sort of thing. And that has given me a bit more freedom to do advocacy work. So I'm hoping, the tide seems to be turning in my view slightly. I think more people are talking about it in Canada, and I'm cautiously hopeful, maybe. Yeah. What do you think, Melanie?
Because it feels to me that around 2023 it was all over the place, and all of a sudden the situation has sort of calmed down a little for other issues. Admittedly, there was October 7, and there's this whole pro-Palestine thing that's been happening. So gender and gender ideology has been less covered. But in America, I believe the situation is a little bit different. There seems to be more coverage critical of some of the issues within trans and gender and all this stuff in the USA, and that does filter into Canada some. I'd be curious to know, Lynn, are you finding that your work in America, you're able to get a message across, you're able to communicate with people some of the issues with adopting a gender-affirming care methodology?
Oh, yes, absolutely. So I've been really active in this arena since about 2019. And as recently as 2022, the media blackout in the US was so extreme that you could not get even a letter to the editor printed in any sort of legacy media. You could not get anyone in the legacy media to even look at the possibility that there might be more than one side to this. And to this day, if we do get anything in the media, it's usually prefaced with, these are very conservative people who have a problem with this, which, calling people conservative is just the easiest way to say they're stupid, don't listen to them. When the fact is that a lot of us are not conservative at all. I happen to be a lesbian. I am advocating for parents constantly. They're coming from every direction. This is a human issue. This is not a left-right issue. This is a humanity issue because we are harming young people by the thousands. And the problem is that some very harmful medical procedures are being touted as a civil rights issue. And it's not only children that are being harmed, but it's also adults, mostly young adults. And it's my philosophy that everybody deserves evidence-based, safe, and effective medical care, period, end of story. It should not be influenced by politics. It is not a civil rights issue to have your penis cut off. It's not a civil rights issue to tell young lesbians that they should have their breasts removed so they can be men. It's not a civil rights issue, and there is no LGBTQ community. There isn't. There's only young, confused people being drastically harmed and sterilized by sloppy, bad, poorly evidenced medical procedures. That's what there is. And the day that they have to go to court and explain themselves, and they can't just resort to, oh, you horrible right-wing bigot, when they have to actually answer the question, that's when you get the information.
And the sad part is that it's mostly girls.
It's girls and it's boys. And, it's mostly girls until your kid is the boy that got caught in it. And I have absolute empathy for both. I think it's easier for people to feel sorry for girls than it is for boys, and that's really sad. And the parents of boys are saying, what's going on with our kids? Will anybody listen? And that's a whole different topic. But yeah, I think it's about 75% girls, and most of them are between the ages of 13 and 17 when they suddenly decide that they're men, and they never were before. Some of them were just kind of tomboys, but a lot of them are just like regular run-of-the-mill girls.
Yeah. So there might be individuals listening today that maybe they got caught up in something that they're now unsure of, or maybe there are parents who want to help their kids who don't know what to do. What can people do to reach out with Themis, or maybe possibly other organizations? I'll throw it to Lynn first. How can people join or help or support?
Yeah, well, we're friends of GenSpect, and so GenSpect has an enormous amount of resources, both in the general organization, and then they have organizations affiliated with them, and we are one of those organizations. So the one organization that's affiliated is called Beyond Trans. Beyond Trans has therapy and resources for families who are struggling. We have I think about 5 weekly Zoom meetings for parents who are struggling with their kids that are going through this. The parents are just going out of their heads. They don't know what to do. So the resources are there. And then if anybody wants to help us with our work of funding lawsuits, we'd absolutely love it if you would come visit our website. We're at themisresourcefund.org. You can learn about and actually read the legal complaints on our website. People can go to our website and find an attorney that wants to take their case. And if you would like to help support our work, which we absolutely need, you can directly help to fund these lawsuits by supporting us financially.
That's great. I really hope that if anybody's listening, please reach out. GenSpect's a great organization, so is Themis, and they will certainly be able to put you in touch with other organizations if they're not the one for you. But I thank you, ladies, for joining me today, and I hope we touch back again soon.
Yeah, thank you so much, Melanie.
Thank you, Melanie.
Sadly, not even medicine is immune to ideology. But when it succumbs to it, it's often the vulnerable who suffer first. My guests today advocate for evidence-based care because they believe in safeguarding young people and the right to change your mind. I think that's something that most people can get behind. Now, if you like, share this episode, subscribe, leave a comment, and keep the conversation going. For True North, I'm Melanie Bennett.